Hey friends, um, I'm on day 34 of staying at home to save lives, now called social isolation, coming to you from cell block 9748. I've been doing a lot of thinking about what we're doing and what's happening in the world, and I was one of the first ones to jump on the Save the Lives bandwagon train. It sounded at first like a great idea. We were hearing these reports coming from the media of the dangers of this virus called COVID-19. People were predicting that it was going to be the biggest pandemic in our lifetime. And I at first felt a little scared when I saw the images in Italy and the piazza and the places that were closed down. And I began to wonder, should I also be afraid for my kids' lives? And so from what I understand it, we decided to socially isolate, to stay away, to protect our most vulnerable. And who are our most vulnerable? The most vulnerable are people that have heart disease, that have cancer, that the elderly, the 85-year-olds, 80-year-olds. So at first it sounded like a great idea. All I have to do is stay home and watch Netflix and homeschool my kids. And it felt like the right thing to do. But after 3 weeks, and they announced that we're going to be staying home indefinitely, and as more and more of our civil liberties began to be taken away, as they began to close parks and tell us they're not sure when things are going to open, I started to really question what was going on. And I think you should be questioning what is going on too. So I want you to listen. And I know what Trump knows, and I know what the media knows, and I have probably already lost you because most people only pay attention for 8 seconds. Neuroscientists say that goldfish now have a larger attention span than most human beings. So let's talk about what's going on. I am not denying that we are in the middle of a pandemic called COVID-19. I understand that this is classified as a respiratory disease that spreads from person to person, and in some cases can result in respiratory failure. But this is what it says on the CDC, the Chinese CDC. This was released back in January. We had information. Anybody can GTS, Google that shit, look it up. We knew who this was going to affect and how. The Chinese CDC clearly detailed who was specifically at risk of COVID-19, stating fatality rate was 14.8% in people 80 or older. Do you hear that? 80-year-olds might die of anything, but they have a 14.8% chance of dying of COVID if they catch it. For them, it can be deadly. By contrast, the fatality rate was 1.3% in people that were 50-somethings, 0.4% in 40-year-olds, and 0.2% in population ages 10 to 39. It even clearly outlines this on the CDC, that this mostly affects people with pre-existing conditions. And to date, there have been 2,173,168 confirmed cases. That sounds horrible, doesn't it? But that's only who we actually know. These are people that felt sick enough to seek out the care of their medical doctor. And this is the number around the entire world. And of that number, 144,949 people have died, said to be due to COVID-19. And 546,296 have recovered. And that is thanks in large part to our amazing medical professionals who do what they do best, and that is saving lives. But here are a few other pandemics that you might have heard of that we need to start talking about, and it relates to COVID-19, and I'll get to that later. But first off, every year, 17 million people die around the world of heart disease. 79,535 deaths are due to diabetes. 800,000 people die a year of suicide. 480,000 of smoking. 2.8 million of obesity. The World Health Organization estimates that 4.2 1.6 million people die every year of air pollution. Do you remember the Titanic? It was thought to be an unsinkable boat. The captain was arrogant, and he thought it would be fun to increase the speed of the Titanic beyond what it was capable of going. It hit an iceberg. First, one compartment flooded, then the next. All 6 compartments flooded, and the boat that was supposed to be unsinkable cracked down the middle, and the whole thing sank, taking 1,500 people with it. We are not much different than the Titanic. The Earth has over 7.8 billion people on it. So line that up with your numbers for COVID. Line that up with the numbers that are infected. 7.8 billion people on this planet live here. Many scientists think that Earth has a maximum carrying capacity of 9 billion to 10 billion people. And it's been said that by the end of this century, we could reach our peak at 12 billion human beings on the face of this Earth. Overpopulation has led to devastation of our natural resources, the ease of transmission of diseases, and mass pollution of our air and water. Despite what you are hearing about COVID-19 deaths, about 230,000 people are added to our planet each day. Has the media told you about any new births? No. All you're hearing about is the deaths related to COVID, not the 230,000 new lives coming onto this planet. So like Earth and the Titanic, the human body has a carrying capacity. Our bodies cannot sustain being hit by icebergs, and icebergs come in all shapes and sizes. Some are unseen in the form of depression, abuse, or they come in the form of a virus. In regards to COVID-19, Trump said, "It's like the flu. We have it totally under control. The outbreak will wash away this summer." Then Fauci said the seasonal flu we deal with every year has a mortality rate of 0.1%, whereas coronavirus is 10 times more lethal. Let's do the math. 0.1 times 10 equals 1% chance of dying of COVID. Now, the chances of passing it on to somebody are much higher, and we don't have those numbers yet. All we know is that it is a contagious virus. So, due to that, the doctor said, stay home. The politicians first told us not to wear a mask, and now they're telling us to wear a mask, and if we don't wear a mask, we will have to pay a fine or possibly go to jail. The local and state government then closed the parks, and this is what really got me pissed off because I love to hike, I love to move, and I go on trails where nobody else is, and they closed that trail as if the virus can jump off a bush and eat my face. It cannot. That is not how this particular virus works. When nobody's around, there's no reason that you can't be out there enjoying yourself in the fresh air. But guess what, people? Fatburger is still open, and you don't even have to get out of your car. You can just drive on through, simply roll on up and get your 2,000 calories of lard. But park benches are dangerous. They could have a bug on them. So let's look. Let's look at this. Who's dying? 73% of Americans that are hospitalized had at least one underlying health condition. Read it. Chronic liver disease, that's from drinking mostly. Smoking, renal disease, immunocompromised, cardiovascular disease, chronic lung disease, diabetes. These are all lifestyle diseases. These are from eating too much, not exercising, not moving. Now, there are some people that have a genetic predisposition where they were born with something like maybe their lungs weren't fully developed. I'm not talking about you. I'm talking about the people that have chosen a lifestyle where now they are at a high risk of dying, not only of COVID-19, but of all of these other things on the list. Rather than taking care of our high-risk individuals and ensuring their personal safety, instead, the state and local governments took away our First Amendment rights and the right to a livelihood. They told everyone to stay home, even if you were 19, even if you were 20, it doesn't matter. They decided it would be best for everyone if we all stayed home. So my question is, given what we know about this virus, and given the fact that we know that the death rate is high, but it's not that deadly in comparison to many of the other viruses that affect people in the human species. So my question is, did we really need to shut down everything for an unspecified amount of time? Did anyone do the math? Did anyone calculate the total possible casualties as it relates to the loss of livelihood? Now, since I happen to be my kindergartner's teacher and my 5th grade teachers and my 8th grade son's teacher now, we know in 8th grade we learn about Newton's third law. For every action, there is an equal and opposite reaction. We do not exist inside a vacuum. You cannot do one thing and not expect it to have an effect on everything. Couldn't we have flooded the ICU with the stockpiles of personal protective gear and ventilators when we found out that this virus was coming, like they did in 2009 for the pandemic then? Did you hear about that one? In 2009, we had a pandemic called the swine flu. It killed between 150,000 to 575,000 people. Why such a huge variable? That doesn't sound like an exact science, does it? That's because medicine is not an exact science, because medicine deals with the human species and we are diverse and complicated. What works for one person might not work for another. And it's hard to establish exactly what the cause of death is, because in all reality, we die for 3 specific reasons. Either our heart stops, our lungs stop, or our brain stops. We give up and we lose the will to live. So are you seeing the big picture? Do you see what happened? Fear was unleashed about a contagion, a contagious virus, and everything shut down. We were all told to stay inside, even though it wouldn't affect everybody. It would only affect our weakest of the population, those that were already sick, those that already had chronic diseases. That's who we all stayed inside for. And as a result, 22 million people have now filed for unemployment. This doesn't account for the hardworking, undocumented people living here, or those that only lost some of their income and don't quite qualify it for unemployment because they're not broke enough. Food banks are struggling to feed everyone. There were icebergs under the water, and because nobody was paying attention, we are all drowning. The American government was already in debt. The people that just want to say, so like make it so easy, like, oh, they can collect unemployment, like that's a fun and wonderful thing. That is not. The American government was $23 trillion in debt. But this is not about money. When people talk about the economy, this is not just about math. This is about human lives. This is about people's right to a livelihood. And that has been taken away by the government, by the local governments, by the state governments. The government can't afford to pay all 22 million people. Do you understand how much money is $1 trillion? This is what $1 billion looks like. This is what $1 trillion looks like. We don't have that much money. And people want to keep saying just tax the rich. Eventually, you run out of rich people. Eventually, you run out of middle class people. And then who are we going to tax? Should we tax the people that are left working? Should we tax our teachers more and our garbage collectors more? Because that's who's still working right now. What happens when they decide it's not worthwhile to keep working? Because they need to get unemployment now too. And let's talk about what happens to the psyche of a man who cannot put food on the table for his family. What happens to the single mom of 3 that now has lost her job and is trying to teach her kids from home and survive on food stamps? What happens to the little girl that gets molested at nighttime by her dad that nobody knows about and her only safe place was at school? Did we calculate their lives when we told everybody to stay home, that they'd be safe at home. According to the CDC, more than 4 million people went to the emergency rooms around the nation during a mental health crisis in 2013. From 2009 to 2011, 1,247 people visited the ER for anxiety. That's right, mental illness. In America, there were 48,344 recorded suicides in 2018. Did anybody think about what might happen when you take away somebody's job, when you take away their freedom? I wonder how they're feeling right about now. Do you think they feel safe at home? When people feel hopeless and like they have no control over their situation, it leads them to do horrible things. There are more than likely 22 million Americans now wondering how they are going to pay for their home. Now, there's a common misconception that once we get this vaccine, everything will be fine. It can take maybe a year, 2 years to come up with this vaccine. Or maybe if we just do enough social distancing long enough, we can flatten that curve. But eventually, you got to let people back out again. And eventually, everybody's going to get the coronavirus. We're all going to get sick. And you know what we're going to do? The strong will build their immune systems. We'll create the antibodies. We'll be fine. But if you have this idea that the vaccine is the answer for every virus, let me tell you, there are a minimum of 320,000 mammalian viruses. It is estimated that the cost of discovering these viruses will be $6.3 billion. There are 219 virus species that are known to be able to infect humans. Do you understand that? We're outnumbered. We're like one species. There's 219 species of viruses. Every year, there's going to be a new virus that's going to come out. What are we going to do? Every time a virus comes out, we shut the whole place down. Viruses aren't going anywhere. Despite what they will tell you, none of this was great. It is all a total disaster. How many lives will be saved from COVID-19? To date, there's been 564,525 lives that we've saved. How many are now unemployed, who more than likely won't die of COVID-19, but might die a slow, gradual death? Because that's what happens when somebody loses their will to live. They die.